Mental health support workers play a vital role in supporting individuals living with mental health challenges. Employers seek candidates who are compassionate, resilient, and knowledgeable about mental health conditions and care strategies. Whether you're applying for your first role or advancing in your career, being well prepared for interviews is crucial. Below are 30 common interview questions and model answers, each crafted to help you showcase your skills and suitability for this essential role. 1. What inspired you to become a mental health support worker? I was inspired by a strong desire to make a meaningful difference in people's lives, especially those experiencing mental health challenges. Seeing how proper support can improve someone's quality of life motivated me to pursue this career. I value empathy, listening, and creating safe spaces for recovery. Personal experiences and volunteer work in community mental health deepened my commitment and helped me realize the importance of compassionate, consistent care. 2. How do you handle challenging behavior from clients? I remain calm, empathetic, and non-judgmental when handling challenging behavior. I use de-escalation techniques, active listening, and clear communication to understand the root cause of the behavior. I also prioritize safety for all involved, including seeking support from colleagues if needed. Building trust and having a well-established support plan help prevent escalation and encourage positive responses. Patience and consistency are key in managing difficult situations effectively. 3. What experience do you have working with individuals with mental health conditions? I have worked with clients experiencing anxiety, depression, schizophrenia, and bipolar disorder. My experience includes assisting with daily living activities, facilitating support groups, and implementing individualized care plans. I also collaborated with healthcare professionals to monitor progress and adjust interventions. These experiences helped me develop strong interpersonal skills, resilience, and a thorough understanding of the challenges individuals face. I'm comfortable supporting clients in various settings, including residential and community environments. 4. How do you maintain professional boundaries with clients? Maintaining professional boundaries is essential to fostering a safe and respectful support environment. I always follow organizational guidelines and ensure interactions remain within appropriate limits. I avoid sharing personal details, refrain from forming friendships, and keep communication clear and professional. Boundaries help protect both the client and support worker, promoting trust and consistency in the care relationship. When issues arise, I consult with my supervisor for guidance. 5. What do you understand about confidentiality in this role? Confidentiality is crucial in mental health support. I understand that clients have the right to privacy, and their personal information must only be shared with authorized personnel or when required by law. I ensure all records are securely stored and discuss sensitive matters in private settings. I explain confidentiality policies to clients and let them know the limits, especially in situations involving harm to self or others, so they can feel safe and informed. 6. How do you support clients experiencing a mental health crisis? During a crisis, I stay calm, ensure the client's immediate safety, and use de-escalation techniques. I listen without judgment and validate their feelings, while following the organization's crisis intervention plan. I may contact emergency services or a mental health professional if necessary. After the crisis, I help the client reflect, identify triggers, and adjust their support plan. Documentation and team communication ensure continuity of care and appropriate follow-up. 7. What strategies do you use to build trust with clients? Building trust takes time and consistency. I use active listening, empathy, and honesty to create a safe and non-judgmental environment. I show respect for their experiences, maintain confidentiality, and follow through on promises. By being reliable, supportive, and patient, clients feel comfortable opening up. I also tailor communication styles to meet individual needs, ensuring they feel heard and understood, which strengthens our working relationship over time. 8. How do you handle stress in your role? I manage stress through healthy coping mechanisms such as regular exercise, mindfulness, and time management. I debrief with colleagues when needed and access supervision or mental health support services provided by the organization. Setting boundaries between work and personal life is crucial. Recognizing early signs of burnout allows me to take proactive steps to maintain my well-being, which ultimately enables me to provide better support to clients. 9. Describe a time you advocated for a client. I once supported a client who was denied access to housing due to their mental health history. I worked with local housing agencies to challenge the decision, provided supporting documentation from healthcare professionals, and attended meetings as their advocate. By highlighting the client's progress and current support plan, we successfully secured appropriate accommodation. Advocacy like this is vital in ensuring clients receive fair and equal access to services and opportunities. 10. How do you adapt your communication style for different clients? I assess each client's communication needs, preferences, and abilities. For some, clear and simple language works best. Others may respond better to visual aids or written instructions. I also consider nonverbal cues and cultural factors. Building rapport helps me understand what makes them comfortable. I regularly check for understanding and encourage feedback to ensure we're aligned. Flexibility and empathy are key to effective, individualized communication in this role. 11. How do you support clients in setting and achieving goals? I collaborate with clients to set realistic, achievable, and meaningful goals using person-centered planning. I break larger goals into smaller, manageable steps and provide consistent encouragement and support along the way. We regularly review progress and adjust the plan as needed. I celebrate their successes and help them overcome setbacks by fostering self-confidence and resilience. Empowering clients to take ownership of their goals builds motivation and supports their recovery journey. 12. What would you do if you suspected a client was being abused? If I suspected abuse, I would follow safeguarding procedures immediately. I would record my observations factually and report the concern to my designated safeguarding lead or supervisor without delay. I'd ensure the client feels supported and safe without confronting potential perpetrators or making promises I can't keep. Protecting vulnerable individuals is a priority, and following correct procedures ensures timely intervention while maintaining confidentiality and professionalism. 13. How do you work as part of a multidisciplinary team? Working in a multidisciplinary team requires strong communication, mutual respect, and collaboration. I regularly share updates, attend team meetings, and contribute to care planning with input from nurses, social workers, therapists, and others. I respect each professional's expertise and value shared goals. This team approach ensures holistic care, informed decision-making, and consistency in support. I also make sure to follow through on agreed actions and maintain transparency in all communications. 14. What is your understanding of person-centered care? Person-centered care means putting the individual's needs, preferences, and goals at the heart of their support plan. It respects their choices, values, and rights while promoting independence and dignity. This approach recognizes that each person is unique and avoids a one-size-fits-all mindset. I ensure clients are actively involved in planning and decision-making, allowing them to take control of their recovery and build trust, confidence, and long-term resilience. 15. How do you ensure cultural sensitivity in your work? I respect and acknowledge cultural differences in beliefs, values, communication styles, and mental health perceptions. I educate myself about cultural practices and avoid assumptions or stereotypes. When in doubt, I ask clients respectfully about their preferences. I also advocate for culturally appropriate services and use interpreters when needed. Cultural sensitivity builds trust, promotes inclusion, and ensures clients receive respectful and personalized care that aligns with their values and identity. 16. What would you do if a client refused support or treatment? I would respect the client's autonomy while exploring their reasons for refusal without judgment. I'd provide clear, accessible information about available support, listen empathetically, and build trust over time. Sometimes resistance stems from fear or past experiences, so patience is key. I would keep communication open and involve the team as necessary. If the refusal posed a risk, I would follow safeguarding protocols while continuing to offer support. 17. How do you stay updated with changes in mental health care practices? I regularly attend training sessions, workshops, and conferences relevant to mental health. I read professional journals, follow guidance from mental health organizations like NICE, and participate in peer discussions. I also learn from supervision sessions and reflective practice. Staying informed helps me apply current, evidence-based approaches in my work and adapt to evolving client needs and service standards. Continuous learning ensures I provide safe, ethical, and effective support. 18. Describe a time you had to de-escalate a tense situation. A client became agitated during a group activity and started shouting. I calmly approached, acknowledged their feelings, and guided them to a quiet space to talk privately. I used active listening and a calm tone to reduce tension. By validating their frustration and offering solutions, they eventually calmed down. I later documented the incident and debriefed with the team. De-escalation requires patience, empathy, and the ability to remain composed under pressure. 19. What role does documentation play in your job? Documentation ensures continuity of care, legal compliance, and clear communication between team members. I maintain accurate, timely, and objective records of client progress, incidents, and interventions. Proper documentation helps track changes, identify patterns, and inform care planning. It also protects both clients and staff by creating a transparent record of actions taken. I always respect confidentiality while ensuring records are stored securely and shared only with authorized personnel. 20. How do you support clients with dual diagnoses, mental health and substance use? I take an integrated, non-judgmental approach by addressing both issues simultaneously. I work with clients to understand the link between their mental health and substance use, providing education, emotional support, and harm reduction strategies. I collaborate with addiction specialists and mental health professionals to develop holistic care plans. Building trust, promoting small, achievable goals, and ensuring consistent communication are key to helping clients manage both conditions and make positive changes. 21. What would you do if a colleague behaved unprofessionally toward a client? I would intervene if it's safe to do so and ensure the client is protected. I document the incident and report it to my supervisor or follow the whistleblowing policy. Protecting clients' rights and dignity is a core responsibility. Addressing unprofessional behavior promptly helps maintain trust, service quality, and ethical standards. I believe accountability and a culture of openness are essential in delivering safe and respectful care. 22. How do you involve families in a client's recovery process? Family involvement can provide emotional support and stability for clients. With the client's consent, I engage families by sharing relevant information, offering education on mental health, and involving them in care planning. I listen to their concerns and provide resources that help them support their loved one effectively. Maintaining open, respectful communication and recognizing the family's role in recovery creates a collaborative environment that enhances client outcomes. 23. Describe your experience with care planning. I create individualized care plans in collaboration with clients, families, and other professionals. Each plan outlines specific goals, support strategies, and risk assessments. I regularly review and update plans based on client progress and changing needs. Person-centered care planning helps ensure that support is meaningful and effective. I document each step clearly and make sure clients are empowered to take an active role in shaping their care journey. 24. How do you handle clients who self-harm? I approach self-harm with empathy and without judgment. I ensure the client's immediate safety, provide emotional support, and explore triggers and coping strategies through open dialogue. I follow risk assessment procedures, involve appropriate professionals, and update safety plans as needed. Building trust and offering consistent support can reduce incidents over time. Education about alternative coping mechanisms and connecting clients with therapy or peer support are also vital. 25. What is your approach to risk assessment? I use structured tools and professional judgment to assess risks related to self-harm, harm to others, neglect, and vulnerability. I gather information from the client, their history, and observations, then document and communicate findings clearly. Risk assessments inform care planning and safety strategies. I regularly review and update assessments as situations evolve. My goal is to minimize harm while supporting autonomy and recovery-focused care. 26. How do you support clients transitioning from inpatient to community care? I assist clients by creating a detailed discharge and transition plan that includes emotional, medical, and practical support. I coordinate with community services, help arrange housing and appointments, and provide emotional reassurance. Maintaining contact during this vulnerable time builds confidence and stability. Encouraging independence while ensuring access to needed services helps reduce readmission risk and supports long-term recovery. 27. How do you manage your workload and prioritize tasks? I use planning tools and to-do lists to manage tasks efficiently. I prioritize urgent and safety-critical duties, delegate when appropriate, and remain flexible to handle unexpected situations. Time management and communication with colleagues ensure team coordination. I also make time for reflective practice and documentation. By staying organized and adaptable, I can meet client needs while maintaining service quality and reducing stress. 28. What are your strengths as a mental health support worker? My key strengths include empathy, strong communication skills, patience, and the ability to remain calm in crisis situations. I'm adaptable, reliable, and deeply committed to person-centered care. I work well in a team and build strong therapeutic relationships with clients. I also have a solid understanding of mental health issues and apply evidence-based approaches in my practice. These strengths help me provide compassionate, consistent, and effective support. 29. What challenges have you faced in this role and how did you overcome them? One challenge was supporting a client with severe anxiety who struggled to engage. I built trust gradually through consistent, non-pressuring interactions and involved them in planning small steps forward. I also worked closely with the clinical team for guidance, patience, flexibility, and maintaining a calm, encouraging presence helped the client begin to open up. Overcoming such challenges requires persistence, teamwork, and a deep understanding of individual needs. 30. Why should we hire you for this role? I bring a strong passion for mental health care, along with hands-on experience, compassion, and a deep respect for clients' dignity and autonomy. I'm dependable, team-oriented, and equipped with skills to manage challenging situations while promoting recovery and well-being. My values align with your organization's mission, and I am committed to continuous learning and delivering high-quality, person-centered support. I'm confident I would be a positive and effective member of your team. Mental health support workers are essential in promoting recovery, well-being, and independence. Preparing well-thought-out responses to common interview questions demonstrates your readiness for this impactful role. Use your real-world experiences, align your values with those of the organization, and show a genuine passion for helping others. With preparation and self-awareness, you can confidently highlight your strengths and secure your place in the mental health field.